Hi, let's talk about how a dentist reads dental x-rays. As you can see here, this is called a dental x-ray, and in specific, it is called as a bite wing. Let's see what are the structures we can see here, okay? As you can see here, this tooth, there is a white layer here. This is called the enamel of the tooth, which is the first layer of the tooth, followed by the gray layer here, which is called dentin. And the deep layer here is like a thin line. This is called nerve of the tooth. Scientific term is the pulp. And we can see here two set of teeth, the top teeth and the lower teeth. They belong to the top left side here and the lower left side here. Let's talk about the shadows and white structures, what we see here. Let's begin with this shadow here. This is called dental caries, and the layman term is a cavity. You can see the similar shadows here. And these x-rays are very valuable in determining cavities in between the teeth, as they are very hard to see with the eyes. And there is one more here. And you can see this white structure here. This is called a dental filling. It looks like a silver filling here. How do I tell it's a silver filling? It's based on the brightness of the filling. And there is one more filling here, here, and here, here. The second x-ray here, again, this is a bite wing. And you can see a white structure here, which is called filling, and a shadow here. This is a cavity underneath the filling. And I would like to talk about this x-ray here, which is different from what we have seen before. This is called a periapical, and we can see the full tooth structure here, not just the half of the tooth, unlike the x-ray before. We can see the full tooth structure, which is different from the previous x-ray. I would like to talk about this tooth in specific. The shadow here represents the cavity, and it is an extensive cavity. And you can see here, this thin line is the nerve canal. As this cavity is communicating with the nerve canal here, and you will see one more shadow here. It looks like the infection of the tooth here. In this case, the dentist usually represents two options. One is to save the tooth by doing a root canal, and the second option is to take out the tooth. And the other interesting feature here, this white line here, is called the sinus floor, and this is the maxillary sinus here. And we usually notice this sinus floor when we take x-rays of the top teeth on the back side. There is another bite wing here showing multiple fillings, and 1, 2, 3, 4, 5 fillings here. I'd like to talk about root canal on this x-ray. As you can see here, this tooth has a white structure here at the nerve canal. This is called root canal filling material, and this is done after root canal treatment is finished. And after root canal treatment, usually dentist recommends a crown. This is the crown here, and you can see two shades here. One is the brighter and one is the gray shade. Brighter shade is the metal component of the crown, and the lighter shade is the porcelain component of the crown. So this is called a porcelain fused metal crown. And the teeth adjacent to it shows fillings here. So this x-ray here is called periapical. Reason being, you can see the full tooth here. Let's talk about this shadows here, which are extensive. That means the cavity is extensive here, which is close to the nerve canal. And I would like to talk about this white lines here. This is called the bone of the jaw. And you can see the shadow here. Why do we see shadow here when there is a receding bone? Usually the bone level is until the neck of the tooth. When it recedes, you will see the shadow here. And this is why the dentist recommends x-rays.